When operating in AED mode, the DFM100 can perform semi-automatic external defibrillation on both adults and infant-child patients. You can also monitor the patient's ECG, SpO2, pulse, EtCO2, and airway respiration rate in AED mode. To defibrillate in AED mode, you turn the therapy knob to AED and the DFM100 announces and displays the current patient category.
Adult mode.
If you need to change it, press the Patient Category button to select the appropriate category. When you do so, all parameter alarm limits change to the new category. These changes are retained when you switch modes. The DFM100 then checks to see if the therapy cable and multifunction electrode pads are properly connected. If not, it advises you to
plug in connector. Insert connector firmly. Apply pads.
Connect the pads to the pad's patient cable. Apply the multifunction electrode pads as directed on the package.
Stay clear of patient. Analyzing. Stay clear.
The DFM100 analyzes the heart rhythm and announces if a shock is advised.
Shock advised.
The DFM100 automatically charges to 150 joules if the adult patient category is selected, or 50 joules if the infant-child category is selected. Once charging is complete, the DFM prompts you with
Shock advised. Deliver shock now.
Make sure no one is touching the patient or anything connected to the patient. Call out clearly and loudly, "Stay clear!" Then press the flashing orange shock button to deliver a shock. Upon delivery of the shock,
Shock delivered.
the shock counter registers the number of shocks delivered. After a shock is delivered, the device pauses and you are prompted,
Begin CPR.
The DFM100 enters a configured CPR timer period and reanalyzes the ECG when the pause period ends or you press Resume Analyzing.
Stay clear of patient. Analyzing. Stay clear.
If a shockable rhythm is not detected, the device tells you,
No shock advised.
Analysis is suspended during the configurable pause period, at which time you administer CPR.